Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. And on this podcast, I'm your host, Dr. Taves. We're going to talk about ear ringing or tinnitus. If you've ever had ringing in your ears, maybe after a long day, a workout, or when your neck feels tight, and wondered if it's connected, we're going to talk about the connection between your neck and ear ringing. What if your ear ringing isn't coming from your ears at all, but it's actually related to your neck or your jaw? You see, we see a lot of people with both headache and migraine symptoms alongside their ear ringing. If that's you, this is going to be particularly helpful podcast for you. If you have headaches or migraines and you don't particularly struggle with ear ringing, I want you to stay tuned because we're going to get into the ins and outs of the neck and the jaw, and it's going to be very practically helpful for really anyone with headaches and migraines. And if you have headaches or migraines, you are at an elevated risk of developing this. And so it's always good to be prepared and understand it. If you start having ear ringing, maybe this podcast will help you not to panic or be concerned. Okay? So the purpose of this podcast is to explain the dysfunction or tension that the neck and jaw can carry, mechanically contributing to ear ringing or tinnitus, and to help you understand the difference between more of an ear-based tinnitus and a somatic or mechanical type tinnitus. And then why it matters is because many people with headaches and migraines also report ear ringing fullness or sensitivity. There's something going on in their ears that they need to figure out, and it coincides with their head pain or their other migraine symptoms. And so we want to talk about that. When we get on the phone with you, when you call us, our director of patient experience, whether that's Jen or Julia, whoever is picking up the phone, will ask you several questions, trying to dig deeper into your story. And oftentimes, tinnitus is something that comes up in someone's presentation of symptoms. And then what we want to do is send a podcast out so that you then get a better idea of specifically how our practice can help you or how we think through this problem. And so if you've received this specific podcast, it's probably because we talked to you on the phone and you have ear ringing, and now you're listening to the podcast that we sent you, which is a wonderful thing. If that's you, we look forward to helping you solve this problem. If that's not you and you have headaches or migraines and tinnitus, reach out to us so that we can help solve this problem for you. Okay, so first off, what is tinnitus? I've heard it pronounced tinnitus. It's really just ear ringing, and so the perception of sound without an external source, meaning something is causing, whether it's a buzzing or a humming or a loud pitch ringing. Sometimes it's a low pitch, but there's a sound without a source. Like there's no bird chirping in your ear, there's no kids screaming, but it sounds like there's just this constant noisy pitch coming from something. And so the common forms are going to be ringing, buzzing, hissing, pulsing, and it affects roughly 1 in 7 adults worldwide. So it's fairly common. Severity and the causes are definitely going to vary, but most people would assume that it's just in your ear, right? It's an ear problem. That's not always true, though, and especially with the people that are coupling it with their headache or migraine, and they also have the ear ringing. We're going to put you in a category where we actually want to understand the mechanism behind the ear ringing instead of just accepting it as a potential ear problem. And so what I want to talk about is the mechanical side of this tinnitus. And so somatic basically means, it's somatic tinnitus, it's mechanical tinnitus, it's the same thing. Somatic means arising from the body. So not necessarily the ear itself. So it comes from somewhere else, right? So it's the type of ear ringing that comes from outside of the ear. It can be modulated, this type of tinnitus. So it can be made louder or softer, especially by movements of the jaw, neck, or head. So a good way to test this on yourself is to try clenching your teeth, turning your head, pressing on your neck muscles, and seeing if you can change the pitch or the intensity of the sound that you're hearing. If you can, it's very likely that you have a mechanical tinnitus or a mechanical component to your ear ringing, which in the context of what we're talking about is a good thing, okay? Now, if you can't, just know like that test on yourself is not super sensitive, meaning if it had a high sensitivity, if it was negative, meaning you did those things, you clenched, you turned your head, you pressed on some neck muscles, and nothing changed. If it had a high sensitivity, that means if it was negative, you could have a fair level of confidence, like, oh, I don't, like, it's not a mechanical problem. But for the sake of our conversation, it's the low sensitivity, meaning if you did those things and nothing changed, that's okay. Like, there's probably a good chance it's still mechanical. But if that did change, then you can have a high level of confidence that it is mechanical. And usually on these podcasts, if I give someone something to like interact with or do or test on themselves, people like that. So I hope that is appreciated, that you can kind of test this on yourself before we even dive into it. It's often going to be linked to jaw dysfunction or TMJ dysfunction, and then bruxism, which is like clenching or grinding your teeth. In addition to that, it's related to neck tension, forward head posture, or previous whiplash injuries. Okay. Just recently, we had a patient who was coming off of a whiplash injury and dealing with ear ringing, and there was a ton of mechanical component to it. Like, there's a lot of things that contributed to the ear ringing that were all mechanical. And so once we improve the mechanics of the neck, of the jaw, of the shoulders, then the ear ringing dies down. And especially in session, when we can manipulate those things, get the ear ringing to drop, even if it increases for a period of time, then we know that there's a mechanical component, and if we keep at it, it should reduce. All right. So the science behind this, how the neck and jaw tension are affecting the ear. There's a few thoughts behind this, and the first is going to be more of looking at the neuroanatomy, so understanding what are called the afferent pathways. So the pathways that basically take information from the ear or from a muscle and send it to the brain. Okay, this would be like a pain signal. So tissue is disruptive, it's bruised, there's inflammation, and it sends the pain signal to the brain. So things going to the brain are called afferent pathways. And there's a sense of crosstalk between the auditory and the somatosensory system. So meaning there's overlap in the brainstem. We've talked about this when it comes to, I'm going to use big words here, and I'll break it down so it is simple and easy to understand. But essentially there's this trigeminal pathway, this trigeminal nucleus that pulls in information from all different areas, okay? So whether it's like the auditory system, the visual system, sensory input from the neck, from the jaw, pain signals, they all meet together in the brain stem in particular, and then they send more of a common signal up into the brain. And so there's crosstalk or overlap that can cause one signal to ramp up the other signals that are in that pathway. And we see this is one of the major things that we need to understand when we're dealing with any type of head or facial pain. And especially when it's not just like, oh, I have a pain in my neck, but it's like a stabbing in my eye. I have light sensitivity. I have nausea. I'm sensitive to bright lights, to loud noises. The right side of my face is droopy and numb. Like, there's all these different sensory inputs and symptoms that a migraine presentation will have. And so when we try to understand that, we have to look less at like, okay, so if your eye is feeling like it's being stabbed and there's nothing actually wrong with your eye, then we have to look at the sensory component and the brain's interpretation of a problem. And then if your eye is fine, we have to understand, okay, the brain is thinking the eye has a problem, but why would it think that? And what we do is we look at anything else that could impact that sensory input or that pathway. And then if there's a problem with one of those other, whether it's tissues or systems along that pathway, then we know that we solve that thing, and then the eye stabbing pain goes away. So when it comes to the ringing in the ear, it's the same type of thing. So we can have tension, we can have tight muscles, irritated joints, and they can actually turn up the volume of what's going through the auditory pathway itself, okay? So tight neck can lead to an increase of volume of what's running through our ear and traveling to our brain because they overlap, they cross paths, and one can impact the other, okay? And then we also have a jaw connection. So the jaw joint and the middle ear, they share this like embryologic and anatomical relationship. And so there's a close proximity and they're tied to each other in a sense physically. So if we have an overactive muscle in the jaw, like there's a few muscle groups, but think of the masseter as the big one, that if you bite down, you usually see it. It kind of creates a dimple on some people. Or the pterygoids are these little tiny muscles that allow the jaw to move side to side. Or maybe like the disc in the jaw joint. There's this little disc that can become like dislodged, dislocated, or irritated. Those things can influence the ear structures, okay? So the muscles that surround the jaw joint itself can impact the ear structures. So the jaw has a close relationship, a close connection, and can impact what's going on in the ear. And then also the neck. So when we think of like chronic neck tension, especially in what's called the SCM, which is that big muscle that runs kind of like potentially maybe in an S shape isn't the best way to describe it, but it runs from like below your ear down into your sternum. And if you turn your head, it'll kind of pop out. And oftentimes when you grab it, it'll be sensitive, especially if you have headaches or migraines. So that's the SCM that can have a connection. The suboccipitals, so any of the muscles at the base of your skull. And then the upper traps. Okay, everyone knows where the upper traps are. The upper traps get blamed for a lot, but yeah, the upper traps, the SCM, suboccipitals. Okay, they are all fair game to impact the ear, increase that nerve input to the brainstem, and that's where that's where like the volume's turned up on the ringing. So things that can contribute to that neck tension, poor posture, prolonged sitting, things like that. The forward head position can increase the amount of tension that's running through the neck and impact what that volume of the ear ringing or the ear's perception to sound. Okay. And so again, how can you tell if it's coming from the neck or the jaw? Here's some questions that you can ask yourself. Does your tinnitus change when you clench your jaw or open your mouth wide? Okay. Open your mouth real wide. See if that changes it. If you turn your head or shrug your shoulders, okay, so that's essentially changing the mechanical stress through the neck momentarily. So if you shrug your shoulders, turn your head, you're impacting the tension. It might increase or decrease the tension. It's not necessarily like shrugging your shoulders always decreases or always increases. But if you get any change by changing the mechanical stress, that's an indication that there's a connection there. If you're pressing on the sore spot, so oftentimes the base of the skull, top part of the neck, and people press there, that's kind of one of the key areas for their headaches or migraines. So pressing there, and then you get some change in the ear ringing. And then if your ear ringing started after a neck injury or a whiplash injury, so maybe you're in a car accident and then your ear's been ringing ever since. Maybe you fell off a horse, or you had some sort of head or neck trauma and your ear's ringing. It's not just that we should check the ear for any sign of trauma or damage to the ear itself. We should understand the impact of the neck and the jaw on the perception of sound and its mechanical impact on the ear, especially after these types of injuries. Another big one is like a dental procedure, a new retainer, a period of high stress. And so going to the The dentist is a big one for people. We definitely have people that have increased jaw symptoms. Potentially, it'll trigger a headache or a migraine because their head's kind of cocked back, holding their jaw open. But especially if you have the ear ringing and then you go to the dentist, it can really ramp up the volume. And essentially, you're in a position where you have to cock your head back, hold your jaw open for an extended period of time. And it's not comfortable, even if there's sort of an awareness of how to make your neck more comfortable. It really can be tough for people to sit through a dental visit. And then, of course, they're like, I don't know, pulling in your teeth or drilling in your tooth or whatever it is that they're doing. And then you leave and things feel a little bit worse. And then if you also get symptoms like jaw pain, clicking, tension through your jaw, and then, of course, neck stiffness or headaches, like I said at the beginning of the podcast. So if you said yes to those things, then it's very likely you have this mechanical origin, and we need to take a neck and jaw focused approach to this treatment process. So people with migraines are much more likely to experience tinnitus because of the shared nerve pathways and the mechanical connections here. Neck dysfunction is definitely a known contributor to both headaches and the mechanical tinnitus. And so when we have patients that describe their neck tension and their tinnitus or their migraines and their ear ringing, we definitely are connecting those two. And we're going to take them through our process and want to see improvements and reduction in both of those things. And so when we improve neck function, when we reduce the level of tension through the neck, when we improve jaw function, and especially in session, if we see a change in the level of ringing in the ear, then we know we can reduce that and long-term get you to the point where you're not having to deal with it anymore. So when it comes to treatment, we definitely, we definitely want to have a manual therapy approach, so hands-on approach to the neck and to the jaw. When the jaw is dysfunctional, when the neck is dysfunctional, often it comes back to the upper cervical spine, so meaning the upper part of the neck has a lot of available motion, and when it's restricted, it can be hard to get the upper neck to move outside of manual therapy, of applying specific pressure to these specific joints. And so if we just did a general exercise program, it can be a little bit challenging, meaning if you go to a physical therapist and they just give you general postural exercises, it can be challenging. We need to get more specific, whether that's with specific exercises, but ultimately coupled with some sort of hands-on manual pressure. If you're listening to this and you're out of state, or we do work with our virtual coaching clients and provide them with the SAM device, which is a way to supplement for that hands-on care. And so reach out to us if you're interested in that. But essentially, we need to apply a physical pressure to the upper part of the neck or to the jaw to get it moving like it should. Things like chin tucks, jaw relaxation techniques, cervical mobility, breathing exercises, these can all be beneficial in order to reduce the amount of stress running and tension running through your neck. Definitely addressing posture and ergonomics. So make sure if you are sitting at a desk job that your desk setup is what it should be, that you're moving as much as you can. Ultimately, if you can stand, let's get you standing. We want to make sure that you're not adding stress to your jaw and your neck by just sitting with a forward head position. If it's more of a jaw and dental focus or origin to this, then we want to look at why you're clenching or grinding your teeth. Maybe there's an airway issue. Maybe you're not sleeping well at night and you're constantly thrusting your jaw forward, having to cock your head back, and that's increasing the amount of ear ringing in the morning. Maybe you have been wearing a night guard and it's protecting your teeth, but it really isn't helping your jaw. And there needs to be a tweak or a different approach in order to accommodate to like clenching or grinding at night. And then we oftentimes will collaborate with dentists that can take more of a jaw or tooth, what's called an occlusal approach. So looking at how the teeth contact each other. And then we also we're going to want to understand the big picture of someone's overall health, developmental barriers. So our 3-spoke framework, if you haven't listened to that podcast, go back and listen to it, because we want to look at someone's overall health and their journey of what got them to this point, especially if there wasn't a clear like trauma or car accident. And if the jaw is involved, oftentimes the jaw is responding to what the neck is doing. And so, but we want to hit both. It's usually not just a jaw problem or just a neck issue, especially when the ear is involved. If there's ear fullness, ear pressure, ear ringing, we want to understand what's going in both scenarios. We want to look for that change, the mechanical change, and once we find that, we know that we can treat it. But really, the key thing to me is headaches and migraines accompanied with the ear ringing. Usually, almost always, there's that connection there. And then if we can help one, we can help the other. So they're generally not separate. It's all wrapped into one. And then we do have people that come to us just for ear ringing. So you don't have to have both. If you have ear ringing, if they've checked the ear, if you kind of hit a dead end, you're still in the right place, because this is something that we treat regularly and have found good success with. So what I want you to do, if this is you, I want you to go to our website, noveraheadachecenter.com, book a visit with us, whether that's initial eval or our free discovery visit, so we can get to hear your story. Call us on the phone. Like I said, our director of patient experience will pick up and ask you a bunch of questions, get to know you better. Our onboarding is relatively slow because we want to make sure that you're a good fit and ready and able to go through our process so that you can find the success that you're looking for. Thank you all so much for being a part of this journey and a listener to the Headache Doctor podcast as we continue on our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.